Hello, my name is Angelica Starrett, and this is my submission for a subcutaneous injection. Okay, so I have my MAR here, and I'm going to go ahead and do my first check. So I'm going to check for the right patient, the right medication, the right dose, the right route, and the right time. So we are doing practice insulin Lispro, 10 units subcutaneous with breakfast, and it is breakfast time, so it is the correct time for controlling of her blood sugar. The patient that we are going to be administering this medication to is patient Millie Larson. Her date of birth is 1/1/1936, medical record number 123456, and is the correct date and time. She has no known allergies. All right, so everything looks appropriate. It's the right situation. No known allergies. So I'm going to go ahead and wash my hands and gather my supplies. So I have here my sanitizer. Okay. Now let's see if I can position this so that you can see. Sorry. Okay, my MAR here. So I'm going to put down a barrier as well. I have my insulin needle, specifically insulin. It is a 29 gauge half-inch needle. I'm going to be collecting 2 alcohol prep pads. One prep pad is to wipe the top of my vial of insulin, and the other prep pad is to cleanse the insertion site for the patient. And just so you guys are aware, I have a grapefruit and I have my sharps container right here. And some gauze for a bandage, kind of in case there's any blood. So, in order, when I pull the medication from the dispenser, I am going to provide my second safety check. So again, comparing it to the MAR, this is for patient Millie Larson. Her date of birth is 1/1/1936, medical record number 123456. She has no known allergies, and right now what is due is the practice insulin Lispro, 10 units subcutaneous with breakfast. This vial contains 100 units per ml. So using our handy dandy calculator, we're going to do 100 divided by 10. So is 10. So there's going to be, in order to give her 10 units, I'm going to have to, the insulin needle comes in 100 units per ml. So we are going to be giving her 10 units, so we're going to fill it up to the 10 mark. And we're going to verify that 3 times just to be sure. 100 divided by 10 is 10. 100 divided by 10 is 10. We want to make sure we're giving the right thing. So practice insulin Lispro, 10 units. There's 100 units per ml, so we're going to give her 10 units. Okay. So In order to aseptically take it off, we're going to just pop that off like that. Wipe off the top of the vial very well. And before I take off the cap, I don't know if you can see that. See, there's the top of the plunger, and there is 10 units, so we're going to put it right at the 10. Check the air. Make sure there's no air bubbles. Fill it to the 10 mark. And for safety, we are going to scoop up the cap. So just for verification, 30, 20, 10, it is right at the line for 10 units. And at the facility that I'm at, if it's giving insulin, we usually do a double nurse check for safety reasons. And then I am going to label this, since I'm taking it away from the med room. On the label, I am putting insulin Lispro 100 units per mil. I'm also going to put the expiration date. The expiration date today is, or this is 2022, and the expiration date is 2031, so it is still good. And I am also going to put the lot number, and I also put my initials and title as well as the date that I drew it up. Okay. Wash my hands one more time. Now let's go see our patient. Knock, knock, knock. Hello, my name's Angel. I'm your Excelsior student nurse. I'm here to give you your insulin with your breakfast. Is it okay if I come in? Yes? Okay, thank you very much. I'm going to wash my hands. Now, before I go any further, I'm going to close the curtains. Make sure you have some privacy, and I have here the armband. Can I please get your name and your date of birth? And I also have my MAR, so I'm going to use this for my third check and make sure that I have the right patient and date of birth. Millie Larson, 1/1/1936, ID number 123456. That all corresponds. Can I make sure that you don't have any allergies? No, I don't have any allergies. Okay, wonderful. Now this insulin is to help control your blood sugar. Have you taken it before? Yes, you have? Okay, I'm going to wash my hands and put on my gloves. Now, this goes into the fatty layer of your skin, which can be either in your belly or behind your arm. Do you prefer one or the other? Your belly? Okay. So we want to make sure that we are rotating sites, that we are observing the area, making sure that there are no red areas, bruises, bumps, hard areas, all of that. This is the belly button. We want to make sure that we're doing it at least 2 inches away from the belly button. Do you have any questions or concerns for me before I inject you? No? Okay. So we are going to before I administer the medication, as well as looking at her name and date of birth, I am once again going to make sure that it is the right time and the right date for this medication. It is breakfast time. She's about to do it. We've already checked her blood sugar. We are going to be giving her 10 units of insulin Lispro, that is what it is. We check the right patient, the right medication, the right dose, the right route, which is subcutaneous, and the right time. We are going to start from the center and work our way out. And we are going to allow that to dry. While I'm allowing it to dry, I'm going to open up my gauze. Okay, so now the area is dry. With a SubQ injection, we want to pinch the skin so it creates a little skin fold. And if it's a skinnier person or not so much fatty tissue, we want to go in at a 45-degree angle. But since this patient is not skinny, we're going to go ahead and go in at a 90-degree angle, dart-like. So here we go. 1, 2, 3, poke. I'm going to inject it nice and slowly. And then we want to hold it there for at least 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Take it out nice and smooth and engage the safety and directly into the sharps container. And then there's no blood, you can just dab it, no rubbing, still no blood. You can definitely put a Band-Aid on there if there is any, but there's no blood. All right. Thank you very much, Miss Larson. So we are going to go ahead and dispose of all of our supplies. I'm going to remove my gloves and wash my hands. Make sure that the patient is in a comfortable position with the bed at the lowest position and with the call light in reach. And now I am going to go ahead and say goodbye to my patient. Thank you very much. Please let me know if there's any questions or concerns in regards to the medication, and make sure that you eat your breakfast after having this fast-acting insulin. And then now I am going to go record on my MAR. I'm going to record what the patient's skin looked like, the lot number, and the expiration date, and that I gave the insulin Lispro and at what time. All right, I think we covered everything. So thank you very much and have a good rest of your day.